Myself, Dr. Abhishek Katakwar. I am Associate Director, Bariatric and Metabolic Surgery. So this is about telling you about what is bariatric and metabolic surgery, because a lot of us do not know what is this surgery is all about. So this surgery is basically about weight loss. Now, world is getting smaller with everything becoming miniature except us, because we are getting obese each and every day, and you can see from 1950s and so far now the things have changed. The human size have become larger and larger, as well as the sodas, cold drinks, and the junk food size has become increasing. So what is obesity? It's a chronic, lifelong, multifactorial, genetically related disease of excessive fat storage with highly significant medical, psychological, social, physical, and economic comorbidities. And obesity is related with multiple problems like sex hormone imbalance, increased free fatty acid, mechanical stress, metabolic syndrome, which includes insulin resistance, hypertension, dyslipidemia, and subsequently other problems like hormone-dependent tumors, type 2 diabetes mellitus, cardiovascular disease, shortness of breath, and other problems. And in the past, obesity was seen as a weakness or a failure of individual, and diet and exercise were the prescribed treatment. And weight loss surgery was viewed as a diagnosis and dangerous and extreme. But now in the present, bariatric surgery has been considered safe and has been recommended by different societies like American Society for Metabolic Bariatric Surgery and International Diabetic Association and American Diabetes Association. And if you see, the prevalence of obesity has been increasing worldwide, not only in India, Asia, but it's been like a pandemic disease. Now, can we do something about this modern world disease? Yes, we can definitely do about it. And the initial thing is the medical management, which is the first line of treatment, which includes calorie restriction, exercise, behavior modification, pharmacotherapy. But the problem is the average weight loss is only 5 to 10% of initial body weight loss, and subsequently a regain of weight after 1 to 2 years. Now, why this happened? Because our body is controlled by so many hormones, and there are satiety hormone, there are hunger hormone. And when we do such kind of activities, which includes dieting and starving, it leads to increase in the hunger hormone and change in your hormonal balance. And by virtue of which you feel more hungry, and not only hungry, but your behavior changes, you become more anxious, you become more irritable when you're doing all those things. Now, bariatric surgery or weight loss surgery has got multiple health benefits, and in research we have proved that it causes 70%, 77, more than 77% excess weight loss, and resolution of all the comorbidities. And the best part is this surgery is done by laparoscopic surgery or a keyhole surgery, and we are now doing all keyhole surgeries as well as single incision bariatric surgery, in which we give just a small incision at your navel and we can operate, and the patient can be home within 3 days. And these are the other comorbidities reduction after bariatric surgery. The list is very long, and you can consider that each and every problem is related to obesity. Now, to understand who are the candidates who can go for bariatric surgery, so for that we have to categorize according to your body mass index. But in present era, we not only think about BMI, but other comorbidities which are important along with BMI, which can make a choice and which can make a decision whether you are a patient for bariatric surgery or not. So NIH consensus says that anyone who has a BMI of more than 40 with comorbidity is a patient who can be considered for bariatric surgery, whereas the guidelines for Asian population and African population could be different, because we have a lot of central obesity. So even at the low BMI, which is more than 32.5, or with a BMI of 27.5 and diabetes, the surgery can be opted. Now, extensive weight loss programs fails, and the biggest example is the Biggest Loser, which I always quote in my lectures and in my talk. Now, bariatric surgery followed by diet, exercise, and behavior modification is important, because bariatric surgery is not like a miracle surgery or it's magic surgery, but it's a tool to help patient lose weight. And it's a multimodality treatment which includes different specialties, because we are not only dealing with obesity but also fatty liver, sleep apnea, and other hormonal imbalance. Now, when we want to classify bariatric surgery, it can be broadly classified into restrictive, malabsorptive, as well as a mixed or combination procedure. I'm going to give you some few examples of how these surgeries are done. Now, one of them is sleeve gastrectomy, which is the most commonly performed bariatric procedure worldwide nowadays, in which we take out approximately 70% of your stomach using surgical staplers, and this procedure is completely done by laparoscopy. And in fact, now we are doing, as I've said, we are doing single incision or reduced port surgery, in which the scar is almost minimal and it looks cosmetically better. So if we see how sleeve gastrectomy is done laparoscopically, we put multiple trocars, and then we enter the abdomen, and if you can see inside, we use different laparoscopic instruments which are highly modified, and there is esophagus, stomach, and when we see the how does the food travels when it goes inside, it has to pass through the big stomach, and then it goes into the second part of duodenum, and virtually finally into the small intestine. And what we do in sleeve gastrectomy is we take out approximately 70% of your stomach, and once this stomach is taken out, the food passes down much faster, the transit time is reduced, as well as when we take out the fundus part of the stomach, the ghrelin hormone, which is responsible for hunger, it's taken down. So the hunger comes down, and once this food reaches down faster towards the small intestine, the good hormones or the anti-incretin hormones are secreted faster, and these hormones are good. They are like GLP-1 and PAYY. Now, when we talk about gastric bypass or laparoscopic Roux-en-Y gastric bypass, in which stomach is stapled into two pieces and a small gastric pouch of around 30 cc is created, followed by the small intestine is disconnected at around 100 centimeter, and then this intestine is brought up and connected to this gastric pouch. So there are two limbs, which one is Roux limb and another is a Y limb or a biliopancreatic limb. And Roux-en-Y gastric bypass is considered as a gold standard bariatric. In laparoscopic Roux-en-Y gastric bypass, we again put multiple trocars, and we go inside, we inspect the small intestine, large intestine, stomach, and esophagus, and then we make a small gastric pouch which is around 30 cc, as I said, and then you can see that bile and pancreatic fluid which goes and get empty into the second part of duodenum. We want to take care of that part, so we create a small gastric pouch of around 30 cc in the stomach using surgical stapler, and then we cut the small intestine at around 100 centimeter from the DJ, and then we bring that loop up, bring that part of intestine up, and then we make a gastrojejunostomy, and then the distal part, which is nothing but the biliopancreatic limb, is connected to this Roux limb. So this is how it helps us in reducing weight, and it is called a gold standard bariatric procedure. Now, there is a new procedure which is called mini gastric bypass, which is also gaining a lot of popularity nowadays, and it's more popular in India, but it's not approved in US so far. Now, when we look at the natural history of obesity leading to type 2 diabetes, we have to understand that all these patients who are obese are going to get diabetic today or tomorrow or someday. So we have to intervene before it's too late and person becomes diabetes, because nowadays diabetes is also increasing worldwide, and the right time to hit these kind of problem is when we know that the beta cell has started declining and the beta cell function is going down. with a lot of insulin resistance. And a lot of my patients who have undergone this surgery, they had a wonderful results as far as diabetes is concerned. Some of them were on insulin and they did not require insulin after surgery. Some of them shifted from insulin to oral hypoglycemic agents. So this surgery, when came into the picture, was basically for obesity, but now it is also called metabolic surgery or a diabetic surgery, because we are seeing wonderful results with advanced procedures which can cure diabetes. Thank you so much for your patient listening. Thank you.